do a neuromuscular technique now for the TFL. Now, as therapists, we know a lot of our patients have problems with their TFL. It's a synergist for glute med. We know the glute med is a muscle that's often weak in people, so the synergist will take over its role and get very, very tight. A quick way to check if someone has a TFL that is too tight or hypertonic is have them laying supine. We look at the feet, and one of those feet will be turned slightly more into internal rotation. That can be an easy indicator that TFL tight because it's an internal rotator. So that's not the only reason it could be there, but if we're looking for that, a bit of a clue that the TFL's tight, an internally rotated leg on one side. So what we're going to do here is use our thumb, our knuckle. You can use a pressure tool, you can use a forearm, an elbow, any tool you like. We're going to apply some pressure directly to the TFL in an inferior and medial direction. So we find the ASIS, we find the fibers of the TFL that come down slightly posterior and inferior from the ASIS, and I'm going to then pin that muscle with my thumb in this case, supporting with my other fingers and pressing into that. So that's a digital ischemic compression into that muscle, and then I can either actively or passively have that client internally and externally rotate that leg. Given that this muscle is an internal rotator, as we go into external rotation, that gives us a nice little stretch. As we go into internal rotation, that's the muscle activating, we get that active release on that technique, on that and the TFL muscle. So we pin it. In this case, I'll get the client to actively roll that leg in and out for me. They probably won't want to do that because it's typically pretty uncomfortable. And I can feel him shuddering a little bit with that technique. So if that's too painful, you can get them to relax, switch it off, and then just use some jostling movements or rolling just gently through that hip. And that gentle shaking or rolling is often a nice way to kind of shake out some of that tension, get them to let that go. And then after a little while, you might find that then they can come back and try that active internal and external rolling again. Good, so you want to take that full range. Often the clients will get this little confused and they'll try to just move their foot, thinking that that's enough. They need to have that movement happening at the hip itself. That's a nice little active release technique for the TFL.